Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. The numbers are staggering. This time, it's 176 overdose deaths in the month of April, the worst April ever. Nearly 6 deaths every single day. This is a 43% increase over last year. Overdose deaths continue to shatter records every single month. And yet, month after month, we get the same words from this Premier. So can the Premier tell us today exactly what steps he has taken since last month to begin to reverse this deadly trend?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank you to the Leader of the Opposition for the question. That these tragic spikes are happening across the country is a tragedy to all the families that have lost loved ones and to everybody that's worked so hard on the front lines to save lives, fighting 2 public health emergencies at the same time. I absolutely had hoped that the coroner's numbers would be lower, would represent a decrease in lives lost to a toxic drug supply. And it is another setback, and particularly for those working on the street to save lives, the peers, I think, of particularly who are losing community members, but everybody in the province. I'm so sorry. We have an expanded in every way overdose response. What might have been, had we not had these measures in place when the pandemic hit, we will not know, although we do know that in the year 2019, the measures British Columbia had brought into place, doubling the number of supervised consumption sites, introducing or expanding access to a medication-assisted treatment, expanded access to naloxone had brought down overdose deaths for the first time since the public health emergency was declared. I would say to the member's question, we continue to expand our overdose response in every way. There are more nurse prescribers being trained. There are more people taking up safer supply. We're continuing to have conversations with the federal government to grant the Section 56 exemption to decriminalize simple possession of illicit drugs as a way to combat stigma. But most significantly, our budget contribution, historic investment in mental health and addictions is the big change from last month's coroner's report. $500 million is more than this province has ever spent. It's going to have impact, and working together, we can save lives.
Leader of the Official Opposition, supplemental.
Well, thank you. And the minister doesn't have to stop and think about what might have been. She needs to stop and think about what is, month after month in British Columbia. Hope is not enough. Words are not enough. The Premier stands up and continually talks about working together, but then rejects the opportunity to do just that. Recently, the opposition leaders each wrote separate letters to the Premier proposing different ways we could work together on this absolutely critical issue. We could work together. 2 separate proposals. And the Premier's response was no. Not only that, he didn't even respond personally to either leader of the opposition. He delegated that to his minister to say no. People are dying. People are dying across British Columbia. And it doesn't matter if they live in Vancouver or whether they live in the Northeast or the Cariboo, the Thompson, or Northern Vancouver Island. We offered to work together on this issue. And the minister can be as chirpy as he wants about this. It is devastating what is going on in British Columbia, and it is time for this government to stand up, work together with the opposition parties, and actually do something. More than half of the deaths are occurring in private residences. What is needed more than ever are affordable and accessible treatment options. So the Premier has an opportunity today to stand up and take immediate steps to ensure that those living with addictions will get the help they need, not based on their ability to pay, but based solely on their need for treatment.
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. We are the only province in Canada significantly scaling up our response to the overdose crisis. Again, for anybody listening who hasn't heard this already, the drug supply, the illicit street drug supply, is increasingly toxic, and that is something borne out in the coroner's reports, and that more people are staying home, using alone, is also has led to a terrible surge in overdose deaths. And to those who have lost loved ones, family members, team members, I'm so sorry. We are expanding in every way more treatment beds. We just added 100 new publicly funded treatment beds in every health authority across the province. Most of them are up and operating now. We're in the process of doubling the number of youth treatment beds, 123 more. Again, that will be in every health authority in the province. This is an unprecedented expansion, and absolutely there is more to do, and I am grateful for the members' support. The solutions that we are pursuing are coming from the grassroots, from the front line of those in the healthcare system working to end the overdose crisis. And we'll continue to draw our lessons from people that are in the field, led by our Overdose Response Center. I'm grateful for everybody's work in this regard.
Member for Surrey White Rock.
Thank you, Mr. Speaker. Guy Felicella is a well-known harm reduction and recovery addict in Vancouver. As he said just yesterday, and I quote, "We talk about solutions to the overdose crisis, but never see them attached. The result? It just continues to worsen. With COVID-19, we see immediate response. Not all public health emergencies are equal," end quote. It was the worst April on record. The death rate is 6 a day, and it's striking people all across the province. So the words from this government, from this Premier, from this minister are not cutting it, and unfortunately, we are seeing the results month after month. My question is to the Premier, will he take action? Will he help the people right now? Will he fund the support that people need and they deserve?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The answer is yes. There has never been more funding put into overdose response. There has never been such an expansion of services that we have a year ago stood up Safe Supply just weeks into the pandemic, but there's been a 400% increase in the number of people taking prescribed Safe Supply as a way to separate them from the tragic toxicity that's increased during COVID. We're the only province in Canada that's doing this. That we have doubled the number of overdose prevention sites since we formed government in 2017 is saving lives. There hasn't been a single fatal overdose at a supervised consumption site. That we have added already this year 100 new publicly funded treatment and recovery beds, that we are doubling youth treatment beds, unprecedented in British Columbia's history, that in this budget 2021, unprecedented $500 million going into mental health and addictions. One of the things that it will fund is another 195 publicly funded treatment beds. Is there more to do? Absolutely. Is the loss of life tragic and heartbreaking? Absolutely. I'm appreciative of the support across the aisle for our budget and for our efforts, and we will continue to work hard with all parties on the ground to expand supports and save lives.
Member for Surrey White Rock, supplemental.
Thank you, Mr. Speaker. And just to the minister's last point, the letter that we received from the Premier completely contradicts the sentiments that the minister just expressed. There has never been a worse increase in overdose deaths than what we're seeing right now. Addictions is killing British Columbians. And people are reaching out and they are trying to get help. But one of the things that is standing in the way of that help is affordability. They have to choose between food, supporting their families, or getting help. And Mr. Speaker, that's wrong. We've asked before, and with a record month for deaths, we'll ask again. Will the Premier commit to investing in a seamless mental health and addiction system that eliminates barriers and ensures people get the help they need when they need it?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The answer is yes. That's the work that we're doing. That's the work laid out by my predecessor, the first in Canada Minister for Mental Health and Addictions, Judy Darcy, worked with British Columbians across the province. That is where we're getting our wisdom on this work to build a pathway to hope. As Dr. Bonnie Henry said, when we formed government in 2017, there was no system of care for mental health and addictions. And so we are working hard every day to build it up while now fighting two public health emergencies. The investments that we've made to date are unprecedented, and they are not enough. That lives are still being lost is testament to the work that continues to be necessary, the work that we continue to be committed to. And if the solutions were in this legislature or in committees, I think we would have this solved already. But the toxicity of the drug supply is killing people every day in every corner of the continent. It is a tragedy that we are working hard every day to overcome.
Member for Saanich North and Islands.
Thank you, Mr. Speaker. Yesterday, in my response to the ministerial statement about the Kamloops Residential School, I noted the impact of provincial and federal government policies to dispossess Indigenous people of their lands and resources. In my riding, the list is exhaustive. Victoria Airport lands were taken as part of the war effort. The Husaitnich were told those lands would be used for an airfield in return following the war. Decades later, they're engaged in a seemingly endless frustration with local authorities and the federal government. James Island is another example of land that was dispossessed for the war effort with promises of return. Now, a billionaire American owner has applied to subdivide the island, and an approving officer in the Ministry of Transportation must decide if that subdivision is in the public interest. SAOT Chief Nick Claxton, the Islands Trust, Central Saanich have all stated that it is not in the public interest, and I can assure this chamber that it is most certainly not in the public interest. Mr. Speaker, in both these cases, Crown governments are all too happy to collect the wealth from the dispossession of Indigenous lands, but sharing that wealth, not so much. Through you, to the Minister of Indigenous Relations and Reconciliation. Yesterday, I highlighted several ways that the provincial government could immediately act. And if the answer is nothing, please just tell us, because I heard Minister Carolyn Bennett try to baffle-gab her way through the current interview this morning, and it was very sad. Minister, what specific and immediate actions have been taken since last Thursday? What resources has our government put in place to support our relatives to confront and heal from the trauma that we're all experiencing and the re-traumatization that this experience has caused?
Minister of Indigenous Relations and Reconciliation.
Well, thank you, and I thank you through you, Mr. Speaker, the member for Saanich North and the Islands, and salute the eloquent statement that he made yesterday on this tragedy. What specifically we are doing is what I believe Judith Sayers, the president of the Nachalnut Tribal Council, called on us to do. She asked for us to seek financial, emotional, spiritual, and educational support from the federal government and work with the First Nations and the churches and other interested groups to address this issue. I've said from the outset, Mr. Speaker, that it's important for our government to work in lockstep with the Indigenous nations concerned and follow their lead, because in each part of the province, the response to this tragedy and the emotional upset that no doubt it has triggered will be something that each nation will express on its own. So there is no simple answer to this, but we are committed to taking those steps and working with them. I've spoken with Cookby Casimir of the Tk'emlúps Serpeknik people specifically about that. And I've spoken with other community leaders about that. And I intend tomorrow to be speaking with the First Nation Leadership Council, and no doubt this issue will be front and center. We stand ready to provide the resources of the provincial government as requested.
Member for Saanich North and the Islands, supplemental.
Thank you, Mr. Speaker, and thank you to the Minister for the response. Reconciling the injustices at the hands of Crown governments is not a partisan effort, Mr. Speaker. We have seen no political party in this province has proven willing or able to do what's expected or necessary. As long as we remain divided by these two sword lengths in our effort, our work will be fragmented and it will be fragile. Yesterday, the Premier boasted that his ministers in his government all have words in their mandate letters. Well, it's necessary to remind the Premier that they are our ministers, and this is our government. And as long as the Premier can stand here and try to take a victory lap when our relatives, our constituents, all the representatives here have constituents, are hurting like this, it should be evidence that the approach that's being taken is flawed. I was elected in 2017. I've been a member of the Select Standing Committee on Aboriginal Affairs since then. British Columbians should know that committee has never met. Never met. We have the power to require witnesses, to compel testimony, to interrogate, to dig, to recommend change. However, rather than truly work collaboratively like we're doing in the Police Act, and that is good work that's happening in the Police Act, this government has chosen to keep this important work to themselves and behind closed doors. As British Columbians can now see in plain sight that there is a lot that this committee could have been and could be doing. Through you, Mr. Speaker, to the Minister of Indigenous Relations and Reconciliation, when are you going to use this committee to invite all parties in this legislature to the table to truly contribute to the reconciliation effort that is the burden that every one of us in this House carries?
Minister of Indigenous Relations and Reconciliation.
Well, thank you, Mr. Speaker, and through you to the member. I believe that my record in serving in a nonpartisan capacity in this regard speaks for itself. My door is open to any member who wishes to speak on issues of this importance, because the member is entirely accurate. This is not a partisan issue in any way, shape, or form. Every single member in the legislature stood up and supported our commitment, our joint commitment to the Declaration of the Rights of Indigenous People, which is a pathway, but only one step along this important road to reconciliation. I will work with any member, Mr. Speaker, who wishes to bring to my attention issues where we can work. And I'm, of course, working closely with federal ministers and others responsible to make sure we can make lasting change in this province as we deconstruct colonialism, the legacy of colonialism, which of course includes the cultural genocide, which is the legacy of residential schools. We have a lot of work to do together, but to the ministers, to the members' point specifically, that work is nonpartisan, and I welcome the spirit in which his question was asked.
Member for West Vancouver, Capilano.
Thank you, Mr. Speaker. I couldn't help but listen to the minister in her last response to my colleague here on mental health say, in 2017, there was no system of care in place. No system of care. Well, I'm sure that Dr. Perry Kendall and Dr. Bonnie Henry will not appreciate that comment. We established, the BC Liberal government established the BC Centre on Substance Use. They provided mass distribution of naloxone and substitution therapies such as Suboxone, and they set up the Foundry Network for Youth, which I hear over and over from the current government talking about how fabulous that is. So there was a lot going on in 2017. And the minister can talk about all of the money and all of the resources that have been put in since then, but it's obviously not working. If it was was working, Mr. Speaker, we would not be standing here time after time after time talking about the deaths that we are seeing from these overdoses, from children, from adults across British Columbia. So you can applaud yourselves all you want. It is not working. Another youth has died of an overdose death in British Columbia. This time it was a 14-year-old boy in Campbell River, Mr. Speaker. We keep asking the Premier when he will take action to make the next month different. So will the Premier take action to prevent more children from dying from overdoses in this province?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. My heart goes out to another Vancouver Island family who's lost a loved one. That we have such young people falling to the increasingly toxic drug supply is a tragedy, and I'm sorry to their friends and family. We are still learning what was at the root of this overdose that was reported yesterday in Campbell River, and I will learn from the investigation, which will inevitably happen. This is part of the process when there is the death of a child, and we'll learn what services were offered and where the gaps are as we continue to build up our system of care. To quote the BC representative for children and youth last month, she said, quote, government is making significant investments, but it's on the backdrop of a system that was woefully inadequate prior. That we don't have the supports in place yet that are saving lives is evidenced by the number of people that are continuing to die. So the work that we are doing, almost $97 million that has just been committed to building up systems of mental health and addiction support and substance use support for young people in particular is at the foundation of Pathway to Hope, building out integrated child and youth teams in the Comox regional district, the Comox school district, to add mental health and substance use practitioners to support families and children. Our budget commitment of $40 million just last month to add 350 new mental health and substance use practitioners in up to now 20 school districts across British Columbia, trying to get at those supports and prevent small problems from turning into big ones. Our doubling of youth treatment beds will all work towards the aim of getting young people the treatment and the support that they need when and where they need it. That's the work that we are doing every day, the system we are trying to build.
Member for West Vancouver Capilano, supplemental.
Thank you, Mr. Speaker. The Pathway to Hope seems to be an aspirational document at this point because it has not made the difference it needs to be made. With the tragic death of 12-year-old Elia Thomas, the government promised, and I quote, to do more and do better. But here we are again. The supports offered by the Premier weren't enough then, and they aren't enough now. Will the Premier do more and do better so we don't lose another youth to overdose?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. With respect to the member, I note that her party's election platform committed only 1/4 of what our government did in the October election platform. That was a fraction of the commitment that we are putting into place, and young people are at the foundation of it. That we are still losing lives is tragic. That we are working hard every day to build up that system of care where there was an inadequate one before is evidenced by the size of the historic budget commitment that we've made. For anybody that's out there that's listening, there are supports for you. I don't want there to be any mischaracterization that there are not supports in place. Are they keeping up with the increasingly toxic drug supply? Clearly not. And that is heartbreaking news. But if you are if you are struggling with mental health or addictions, whether you are young or old, there are supports for you. On Vancouver Island alone, 5 new urgent primary care centers, which offer 7-day-a-week walk-in mental health and substance use counseling, 12 child and youth mental health clinic intakes on Vancouver Island alone. We've added 2 new Foundry centers that are available to youth, designed by and for youth, and there is more. Please, if you are struggling, please reach out for help.
Member for Peace River North.
Mr. Speaker, youth and families that have lost loved ones deserve action now. That's a line that we've been hearing a lot over the last few years in this chamber. Last month, the Premier was adamant that safe care legislation was coming, and I quote, "We will bring back the bill. We will step in and we will help people who need help," end quote. When will the Premier be introducing legislation that helps parents and families?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. We've heard from families who have lost loved ones, have lost children, who say that stabilization following an overdose might have saved their children's life, might have helped connect them to the addictions treatment and mental health counseling that they needed. That's something that we have heard and that I continue to hear from British Columbians, and we remain committed to protecting youth in the aftermath of an overdose. The work that I've been focused on is building up the voluntary supports that would be in place then in the aftermath of an overdose, and that's a criticism that we heard from people in the movement last summer.
Peace River North supplemental.
It's almost been a year now since the government was forced to pause Bill 22 because they had failed to do proper consultation. Indigenous leaders, in particular, rightfully called for proper consultation. So after delaying action for nearly a year, can the Premier describe the consultations that have taken place, if they are complete, and the results of the consultation?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I've continued to hear from people, Indigenous leaders, families, about their advice and views on stabilization care. We have not conducted consultation. As I've said, every time I've been asked in the House, my focus, the focus of my ministry, has been on building up the voluntary supports that we heard last summer are needed, and we continue to hear from families are needed. And so the building up more voluntary supports will aid those complex conversations about how to move forward with the legislation. And that consultation is ahead of us. We've been working with First Nations Health Authority about how to design those conversations in Indigenous communities and throughout the sector. I will take the opportunity, though, Mr. Speaker, just to clarify again that what we're talking about is stabilization care. It is not forced treatment. It is very different from the Safe Care Act that the opposition proposed in the past, very different from the legislation that is in place in Alberta. This is a healthcare issue. Addiction is a healthcare issue, and the legislation that we will table in the future will reflect that. This is not a criminal issue. We will not be advancing forced treatment.
Opposition House Leader.
Thank you, Mr. Speaker. Well, the question was about what consultation was done on the piece of legislation this government introduced and then pulled back because they had not consulted properly with Indigenous communities, and it's going on a year now. Indigenous people continue to be disproportionately represented in the overdose numbers. While accounting for just over 3% of BC's population, almost 15% of all overdose deaths last year were Indigenous. First Nations women are almost 10 times as likely to die from an overdose. In fact, the First Nations report that came out last week showed 254 First Nations people died last year, more than double the year before. So again, to the Minister, what consultations have been taking place over the last year? And if they haven't been taking place, why have they not been taking place? Time is wasting. First Nations need to be properly consulted on this critical issue.
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The devastating losses, particularly in Indigenous communities, are felt in every corner of the province. These are our friends, our family, our community members. And the report from First Nations Health Authority summarizing the loss of life and overdose deaths just last week is devastating, and it is an indictment of the racism that remains embedded within our society, our justice system, and our healthcare system. It's work we are determined as a government to root out. The approach last summer around and building up to the introduction of Bill 22 was to work with the First Nations Health Authority. That is the health delivery organization that is by and for Indigenous people. We have a tripartite agreement, federal, provincial, and First Nations Health Authority agreement that directs how we'll work together. And when we pick up the work with stabilization care legislation under my tenure, then it will again be with First Nations Health Authority, and they're helping us design that work. We have made vital investments to support Indigenous-led responses to the overdose crisis. That includes nasal naloxone for First Nations communities, prescribed safer supply programs through First Nations Health Authority's virtual substance use and psychiatry services. And we are funding with First Nations Health Authority reconstruction of First Nations addiction treatment and recovery healing centers, and also investing in their land-based healing solutions. It's the only way out of this crisis is working together. I just spoke this morning with the First Nations Health Council and First Nations Health Authority about the path forward and our determination to work together.